Happy midweek, Glam Squad. Welcome to another episode of The Glam. My name is Tracy Wanjiru, and here is where your beauty is cherished, your wellness is prioritized, and your heart is treasured. Now, we've done another episode. By the way, if you've missed out on that episode, we're talking about weight loss solutions. Make sure to check out www.ntvkenya.co.ke. But now, come back. Now, we were looking at some weight loss solutions, and we were debunking a lot of myths, answering some of your most asked questions. And today we are here at Halcyon Healthcare Center to learn more about the medical weight loss treatments that they offer. With the rise of social media trends, we're seeing a lot of trends online, weight loss trends online, and you might be asking yourself, what is right for me? What should I not do? Am I the ideal candidate? And that's why we're here at Halcyon Healthcare Center to learn more about the risks. We want to learn more about, do they actually work? We want to learn about the process. What does it mean when I commit to a particular weight loss solution? So that is what we're here to do. So it's going to be a really informative one. Sit down. If you need a book, write down your notes. If you're one of those people that's been looking to lose weight and you're having a really hard time doing that, then today's episode is going to answer all the questions that you have. So without further ado, let's go meet Dr. Iqbal, who is going to take us through today's process, okay? Because it is a lot. However, it is important that you get the right information, especially when it comes to your body. You don't want to put things in your body that are not right for you. So let's go. Let's make sure that we are doing the right thing for ourselves. Remember, this is where your wellness is prioritized. Let's go.
Hi Tracy, welcome again. So at Halcyon Hospital, we are a group of hospitals. Basically, we are a level 4B specialist hospital, and what we specialize in is in three things. So we have bariatrics, which is medical weight loss. Then we have gastro, which is stomach issues, and hepatobiliary, which is basically the metabolic organs. So we are a 3-in-1 specialty center. We are a team of doctors. So of course there is myself, we have our nutritionists, our psychologists, our surgeons. So it's always a team approach. So when it comes to weight loss, it's always important to take a holistic approach, because all these different factors, from hormones to genetics to metabolism, affect a patient's journey overall. The other thing we like to focus on as a team, as a multidisciplinary team, is that we want to focus on preventative health. So we are not doing sort of cosmetic sort of weight loss. We are actually into medical weight loss, where we are trying to prevent diseases, obesity, and all the diseases related to obesity. You might have heard of some of them, like pressure, diabetes, for ladies, joint issues, infertility, such things.
So I noticed that you were very, you emphasized the fact that this is medical weight loss. What is the difference between just weight loss and medical weight loss options?
Yeah, so of course there is, you see, when we talk about medical weight loss, we're talking about obesity. Obesity in itself is a chronic recurring disease. If you look at the WHO, they actually define obesity as a disease. So we are fighting this disease. It's just like any other disease, like diabetes, hypertension. So that is medical. Whereas when you look at cosmetic, it's just maybe someone who just wants to look good, feel good. That is different. So when you look at the medical aspect, there is that element of, okay, this patient has already tried everything. Maybe they have other medical issues, concerns because of the obesity, and that is actually what we treat.
Okay. Have you seen a rise in, medical weight issues, in the recent years? And what would you say, or what would you attribute to the reason why there's a rise to that?
Yeah, so it all falls back to the lifestyle. So, back in the day, people were more active, but now these days, people, they're a sitting job, they're in their car, they're at home. So it's sort of a sedentary kind of lifestyle. Then when you look at the diet, people are eating a lot of junks, not exercising, they have a lot of stress. So all those lifestyle factors impact in this now leading to obesity.
Okay.
And this is now people who also develop diabetes, hypertension. So of course an obese person might think it's not an issue for them currently, but in the 5 years time, 6 years time, they might develop some of these medical issues.
Yeah.
So the idea is prevention. So ours is more to instead of treating the diabetes and the hypertension, we actually here to prevent it from happening in the first place.
Okay. Who are the right candidates for the different weight loss solutions that you have here at Halcyon Healthcare?
So usually we look at the BMI. That's the first thing. So anyone with a BMI of above 26 do qualify for any of the sort of medical weight loss solutions.
Yeah.
But also it has to be someone who's already tried lifestyle changes by themselves and they have not achieved. Someone who probably has diabetes or something like high blood pressure, or maybe even infertility for ladies. Those are the kind of candidates.
What are some things that you would like, our audience to know as we start this journey in regards to, weight loss trends? Because we're seeing a lot of, influencers, celebrities, sort of get into different treatments, yeah? And everyone who's watching is probably impressed upon, to probably do the same. What are some of the things that you would say are do's and what are don'ts?
Okay, so people who are seeking weight loss, this is of course medical weight loss. It's important to understand these are all tools. So as a specialty center who deal in medical weight loss, there are many different options. There are surgical options, there are non-surgical options. Then it also boils down to what are you comfortable with.
Yeah.
So surgical options, of course, they are more invasive. They have sort of higher risks, whereas non-surgical options have lower risks and they are more sort of safer solutions. So it all depends on what the patient wants, but at the end of the day, it's a tool. It's a tool that will help them develop the right lifestyle changes that they need to maintain throughout their life to achieve their goals. Now, in terms of the trends, of course, there are different trends. There was a time that balloon was more popular. These days, the injections are more popular, but it all depends on what actually works for you. That is why it is important to seek medical care and not sort of self-administer anything to yourself.
Okay, so lastly, before now we get to see the entire process the way you guys do it here at Halcyon, there was a safety alert warning shared by the Pharmacy and Poisons Board in regards to the semaglutide shots. Many people would think now any shots are not safe. So what would be your medical advice to anyone who probably most of us saw that notice or warning?
Ozempic, a prescription drug meant for managing type 2 diabetes. But in Kenya, it's trending for something else, weight loss.
Yeah, so you see, all these drugs are prescription only, meaning that only a doctor who is, of course, certified to prescribe such drugs. So there's definitely, you cannot buy them off the counter and self-administer. So that is the main take-home point, that do not self-prescribe. Of course, if it's done by a professional who has experience in this field, then it has the positive. The negatives are there as well, but that is why you have to do it with a medical personnel, with a center that can deal with any of the issues should they arise.
Okay, and the issues, I know I've seen a lot of cases of, there was an Ozempic lawsuit just recently, and a lot of the guys that they talked about thyroid cancer, blindness, a couple of other issues, and this might seem very terrible, especially as side effects. What side effects do you say are like red flags when it comes to you starting your weight loss journey?
Severe side effects have been associated with the drug, among them nausea, constipation, diarrhea, dehydration, and ultimately damage to the kidneys.
So the complications and the side effects are there, but before the patient starts on any of our program, we'll rule out the contraindications.
Okay.
So anyone who's not eligible for this any treatment, whether it be a surgery, be it a medication, we usually rule out the contraindications. Now, of course, if the side effects may still be present even after you qualify, but that is why you have that medical guidance, such that if you have any such complication, even before it occurs, number one, we want to prevent it, and secondly, is about the management. So if you're managed properly, then even if the complications, the side effect were to arise, you're with the right medical team who know how to manage it.
Okay, fantastic. So we're ready to see what you guys have for us today. So we'll get to meet your patient shortly, and yeah, you can take us through.
Okay, most welcome. Hi Maggie, welcome back from the trash. So we have your readings here. So I can see you are in the BMI category 36. You're in what we call obesity category 2, which is, of course, that's why you're here. Your weight is at about 96 kilos, and the rest of your parameters are okay. So now, having this said, now let's discuss the different options we can explore to help you manage this obesity. And I'm also seeing from your medical profile you have some joint issues, swelling of feet. You've tried some other treatment as well. Okay, fine. So maybe I can ask you, what have you tried before, and what has worked, what hasn't worked?
I've tried gymming, which I gave up because of consistency of work. I have tried a drug for weight loss, and I have tried intermittent fasting.
Okay.
Yeah.
How long have you tried this for?
4 years now. Now it's my 5th year.
Okay.
Yeah. Because after giving birth, my weight just skyrocketed. I've been trying to turn it down, but it doesn't go. Yeah.
Okay, so what has prompted you to seek medical help now? You know, why not a month ago? Why not a year ago? Why now?
Because I'm having difficulties in sleeping. When I go to bed, I have a bit of anxiety. I have backaches, consistent backaches. Then knee joints, especially pain when I'm going up the stairs, or when I walk frequently, I have a lot of joint pains. And yeah, I just feel like I'm not myself, because now you feel like your weight is like slowing you down. Yeah, especially with our jobs that you have to keep being active. Yeah, it's slowing me down, because you can actually feel like you're, I wanted to say fat, but you can feel like your weight is there. Yeah.
When it comes to medical weight loss, we're looking at surgical options, non-surgical options. There's a variety of options. I'll take you to the different options, and just to understand a brief overview of what the options are, then we can discuss something that is workable for you, something that of course we recommend and which is workable for you, and then we can take it from there. Okay. So I'll refer you to the screen here, where I'll take you through the different options we have, just to give you an overview. So of course, when we come to weight loss, we'll discuss obesity first. Okay. So when we discuss obesity, these are your parameters, as you can see. Okay. Yeah. So you're in this red category here. Okay. So you're in this red category here, obesity class 2. Okay. So we want to get you to this yellow category. That is the idea. This is basically what BMI is, what the medical analysis of your weight is. So we want to make you, to jump you from here to here, and for that you need to lose around 15 kilos or so. Okay, you need 15 kilos from here to here, then another 15 from here to here. So that is the goal we are looking at medically. Okay. Now the options are many, so we divide them into surgical options and non-surgical options. Okay. So for your case, since you're in obesity category 2, you qualify for either of them, the surgical or the non-surgical. Okay. But for someone who is in a obesity category 1, then they only qualify for non-surgical options. So for you, these are the non-surgical options. So we have something called the endo sleeve, we have something called gastric Botox, there's another one called weight loss injections, and then we have the different types of gastric balloons as well in terms of non-surgical options. I'll take you more in depth, and then we have the surgical options like the gastric sleeve, the gastric bypass, mini bypass, and such things. Okay. So when you look at all these options, all of them they work. Okay, all of them they work, but it's about what works for you and what, based on your medical analysis, what actually fits you the best. So I'll start with okay. So what do you feel, or from your own research, what do you feel? Do you want a surgical option or you want a non-surgical?
Definitely a non-surgical. Yeah.
What is the reason?
I feel like it's non-invasive, so I don't think I will struggle much in the healing process.
Okay.
Yeah.
So I'll take you through the different options. Let me start with the balloons, and then we'll talk about the medications, the injections, and such. So when it comes to the balloons, this is what they look like. Huh? This is a gastric balloon. Okay. So we have two different types here. So this first one, you swallow it like a pill. Okay. You swallow it like a pill. When the pill goes down inside your stomach, we inflate the pill. It becomes this water-filled balloon. So it's a half a liter balloon basically. Okay. Now, why are we putting this balloon inside your stomach? Your stomach is 1 liter. The balloon is half a liter. That means it has reduced your stomach's capacity by a half. Your portions, cravings, snacking, biting, basically your caloric intake goes significantly lower, and you feel full and you're losing weight because you don't have much calories coming in. That is the basic idea behind the balloon. The balloon will help you control your portions, but also you need to look at what the type of food, are you exercising a bit, mental stressor. So all that plays a role in your overall journey. The balloons, we have different types, so they range from 5 months balloon to 6 months to 12 months, depending on what you actually opt for. But generally the results, you get between 10% to 20% of your total body weight in about 6 months time. The other thing with the balloon, of course, there are side effects. Just like any other procedure, the balloon also has side effects, things like nausea, vomiting. Some patients might get some acidity initially. All these things happen for the first maybe a few days, and then everything wears off eventually. That is why this is also an option. You cannot self-administer, or you cannot do it by yourself. You need to do it with a professional, whereby we'll take you through the program with the team members. So that is one option about the balloons. Now let's discuss another option about the pills. There are so many different pills out in the market, but the idea is we classify them into these 3 categories. So we have what we call the weight loss supplements. Okay. Then we have something called the malabsorption pills, and then the last category we have is appetite suppressor medication. Now for all of these options, basically it's a once a day pill or a twice or thrice a day pill. You need to use them for at least 3 months to 4 months. Okay, they do work generally slowly because it's a slower sort of weight loss. And again, you do need to look at your diet, the exercise routine, the lifestyle changes have to be there. Okay, so the pills do work, but then again you have to look at your goal. You see, we looked at your goal being around almost 15 kilos. So this is something probably will not get you that there very fast. Another thing is we're looking at, is it really treating the obesity itself? Are you developing that lifestyle change that you need to prevent diseases in the future? They also come with their own set of side effects, just like any other medication. So some of them you may develop sleeplessness. Some you have what you call heart palpitations, very fast heart rate. Others you get some mild fatigue. Usually the side effects are there, but again you need to follow up with us, just in case if you have any side effect, we'll advise you. So that is about the pills option, basically the medication option. Maybe any questions on this one? Okay. So let me go to the last option we have, where we'll talk about the injection. So for the injections, we're talking about the weight loss injectables. Okay. So this is so what are they and how do they work? Okay. So generally there are many different types. They come in many different names, different chemical names, different brand names, but all of them they are once a weekly jab. Okay, that's a subcutaneous injection. It is not actually painful. Okay, so you just do it once a week and you keep on doing every week for at least 3 months or so. Okay, now these drugs initially they were approved, or they were meant for diabetes, for treatment of diabetes. But with time, the doctors realized that it's also helping with obesity management and management of obesity-related diseases. So of course now they are being used for the weight loss management. So how do they work? They have a couple of molecules. I'll just call them molecules for the sake of understanding. And we have different molecules. So there's one called GLP, there's another one called GIP. Generally, what these molecules do is basically they improve the insulin secretion and they improve the insulin sensitivity as well, meaning that you get better sugar control. Okay, they help with the sugar control, and if they are controlling your sugar as well, then that means there is no weight gain as well, because when you have a lot of sugar, a lot of caloric intake, then that excess sugar is converted to fats, and that is the process that this drug stops or helps reduce. So number one is, of course, it helps you reduce the caloric intake and of course reduce the sugar, thereby helping you with your fat loss or weight loss. The second aspect is that these molecules, they also suppress your appetite. So they work on your appetite regulation, they work on your satiety. So you find yourself, you're craving less, snacking less, biting less. Generally your appetite has gone down, so you start losing weight. And then the last thing that they do is basically they slow your gastric emptying, meaning that when you eat, the food is being processed very slowly, so you stay full for longer. So that is basically the three mechanisms by which it works. It helps with the
insulin resistance.
Exactly, and it also helps with the cravings, the snacking, and it also helps you keep you full for longer. Now, besides those, of course, that is directly how they impact your weight, but they have other benefits as well. Like, you know, they help you prevent diabetes, they help you prevent cholesterol, for ladies, some infertility issues. So all these things, there's an indirect effect. So it helps with all these obesity related diseases. Now let's talk about side effects for these, for the injection. So side effects, we categorize them into side effects and complications. Side effects are the mild things or moderate things you might have, mild nausea, some patients get some mild fatigue, mild constipation. These are some of the side effects. But then there are complications or adverse effects while you might be on these drugs, things like pancreatitis, you might very low blood sugars and such things. So the complications are there, but they are very rare percentage. They are actually 0.1% based on the studies, the medical studies that have been done worldwide. So the drugs work, but you have to do it like a program under medical supervision. It's a prescription only medication, so it's only a doctor who can recommend you this treatment, and then you have to be under continuous monitoring with the nutritionist. We have a nutritionist, there's a psychologist, there's a couple of doctors who will be monitoring you, and ultimately there is also a continuous follow-up. So every 2 weeks we'll be checking on you. Are you getting any side effects? How are your results? And such things.
Okay.
So the drugs work, but you have to do them for the right indication. So if it's for treating obesity, treating recurrent unmanaged obesity, then they are prescribed for that. And it's also for prevention of diseases, chronic diseases. But you need to change your lifestyle for them to work effectively and to prevent complications and side effects. Basically, those are some of the options we have. So the medications, the injections, and the balloons. Those are the three non-surgical options. Of course, there are many others, but those are the main ones. So now, okay, so what happens? How do you know, or what do you find is more workable for you based on your own? And now that you've understood what the options are, how they work?
The injectables.
Injectables. Yeah. Okay, so what happens usually is that we'll take a medical profile, we'll take your medical history, then we'll run some lab tests, okay? Then we will see, based on that medical profile, based on the lab tests, whether you're eligible for the treatment, number one. And number two, if you're eligible for treatment, then which treatment is it? Okay, sometimes you might not be eligible for the injectables, you might be eligible for another option. Okay, so it all depends on your medical profile. So that analysis has to be done before we start you on any of these treatments.
Okay. Whoa, what a ride it's been. We've just taken a deep dive with Iqbal into the world of clinical weight loss. And let's be real, it's not just about numbers on a scale, right? It's science, it's mindset, it's you versus you. But guess what? The journey doesn't stop here. Oh no, we are just getting warmed up. Next week, we're rolling out part 2, and this time we're walking side by side with Maggie. From her very first chat with a nutritionist to getting real with her psychotherapist, and yes, even that moment of truth, her first injection. So you'll get to see it all. The nerves, the laughs, the real life stuff. It's raw, it's honest, and it might just inspire you. So mark your calendars, set those reminders, tattoo it in your brain. Same time next Wednesday at 7:30 p.m. only on NTV. Until then, stay curious, stay fabulous, and of course, stay glam. Happy take.
Hi Tracy. Welcome.
We'll do. We've already met.
So we've already
So-
met.
Twende.